Okay. Uh, Thank you for coming tonight. This is our 11th speaker as part of our 11-part series. We want to say thanks to the Cancer Action Coalition of Virginia and the CDC for providing this grant to make this really special series possible. Um, as you may have seen or may have caught up on YouTube, all our sessions over the last couple of months have been recorded and uploaded. They'll continue to live online there on our YouTube channel, and we hope to get perhaps them up on our Life with Cancer webpage as well. So we're ending tonight on June 3rd. I can't believe it's come to an end, but it's been awesome. Um, Again, I'm one of the oncology nurse navigators at Life with Cancer. Life with Cancer is part of the integrated system of care at Inova Shar Cancer. We are able to provide education, support to anybody impacted by cancer. We do this by offering programs from diagnosis through survivorship. No matter where treatment is received, we're able to do this at no cost for anybody who wants to participate. Our mission is to enhance the quality of life of those impacted by cancer, providing evidence-based education and support through wellness programs and integrative therapies. So we do this in a number of ways. We do this in person, we do this online, we do this at all our cancer centers here at Inova. We're community funded, and we have a huge team now of oncology clinicians and staff being able to support anybody impacted by a cancer diagnosis. In addition to our wonderful series over the last 6 months, we have a specialty shop over at the flagship Inova Shar Cancer. We are able to offer individuals anything related to supporting sexual health and cancer, from bra fittings and prosthesis to wig services and other types of garments, bathing suits, items to make you feel good. In addition to that, we have moisturizers, lubricants, we have dilators. Those can be purchased in the shop with very sensitive staff that runs the shop or mailed to your house. So should anything in this series interest you and you have more questions, we're able to help you out at the specialty shop. And as our other sessions have gone on, we'll do the same for this program here. We have a Q&A feature. You can ask questions for Dr. Jamia that can be answered at the end of the program that she'll address. If you want to use the chat feature or she wants you to be engaged during the presentation, you can use the chat. You can put comments and responses in there. We just ask that you rename yourself if you can on your screen here so that we can keep track of who's registered for this group and be able to send out emails for evaluation. And if any other communication needs to go out, we'll be able to get that to you. And now I'd like to introduce our wonderful speaker tonight. We may have saved the best for last. I guess if you're the last speaker, we got to introduce you that way.
I love it.
Dr. Emily Jamia is an award-winning sex and relationship therapist, and the USA Today has deemed her best-selling author. Her book, as you can see behind her there, Anatomy of Desire: 5 Secrets to Create Connection and Cultivate Passion. Emily is a sought-after keynote speaker who presents both nationally and internationally to all types of diverse audiences, including educators, health and mental health professionals, corporate leaders, and the general public. Her expertise has been featured in Oprah Magazine, CNN, USA Today, NBC, and more. Dr. Jamia is an award-winning columnist for Healthy Women and was named as a 2025 Outstanding Woman in Medicine by the Arts of Healing Foundation. She hosts Love and Libido podcasts and writes for Psychology Today, and she posts across all social media channels at Dr. Emily Jamia. So welcome, thank you, coming from Texas tonight, presenting to all our attendees from all over the country today. Welcome, Dr. Jamia. Thanks for coming tonight.
Thank you so much for hosting me, Rebecca. I am thrilled to be here with you and everyone else who joined in tonight. So thank you all. I am kind of a questions as we go kind of gal. So if you have a burning question, don't wait until the very end. You can go ahead and pop it in the chat. I find that that really enriches the presentation. So don't be shy. And then, of course, I'll leave additional time at the end to answer any questions that maybe you didn't think of until then. So I'm going to go ahead and share my screen and we will open. Okay. Can everyone see that okay? Let me go to.
I can't see your screen. It says it's
Oh,
showing, but
you can't?
think it's coming, but it's starting like
Let's see.
there it is.
Now you can?
yes, you're
Okay,
good.
awesome. All right. So I want to open with this quote that has always spoken to me since I first read it several years ago. It comes from The Hero with a Thousand Faces by Joseph Campbell. It says, "Only birth can conquer death. The birth not of the old thing again, but of something new within the soul, within the body social. There must be, if we are to experience long survival, a continuous recurrence of birth to nullify the unremitting recurrences of death." And I feel like this concept applies to so much in life. You know, a lot of times when we're going through a struggle, it's really easy to look back and try to identify a place that we'd like to go back to. But because of the way life works, we can't do that. And especially when I'm working with couples to try to revive their sex life after a trauma, like going through cancer or a relationship betrayal or whatever it may be, I'm always talking to them about how we are creating something new and different that is going to be different in many ways than what you experienced before. And I think that's especially important to keep in mind when navigating sex and desire through one's cancer journey. Okay. Oops. Let's see what's happening. Okay. So sexual desire does not live in a box apart from life. As much as we wish it did, it just doesn't work like that. There are so many factors that influence the way we feel about our sexuality. We've got body image. We've got life adjustments. We've got hormonal changes like happen during nursing or menopause, or maybe hormonal changes from cancer treatments, relationship conflict, history of trauma, religion and spirituality, medications, prescription drugs, the internet, hormones again, they do play a role. And I put this slide on here because, you know, especially women going through cancer treatments, they can kind of experience like an early menopause, as I'm sure you guys have talked about. Emotional distress, depression, anxiety, love and chemistry, sexual dysfunction, STDs, relationship betrayal, infidelity. And if you still can't pinpoint anything, you can always blame your parents. So let's talk about desire. Desire is individual, it is relational, it is environmental. So whatever is going on with you internally, whatever is happening between you and your partner, and whatever is happening in the environment around you is all going to impact your relationship to desire. And I always tell people that desire is like a fingerprint. It is going to be different in some way, shape, or form than anybody else's desire or sexuality, which is why as therapists, we are always looking at treating it. We kind of use a biopsychosocial framework. So we're looking at the biological components, the psychological components, and the social components. And when going through something like a cancer diagnosis or treatment, or figuring out who you are on the other side, all of these factors are going to play a role. And if they haven't yet, going through something as life-changing as cancer, is for most people going to force you to kind of examine the way all of these things play a role, maybe in a way that you had never considered before. I want to play. So I have a podcast called Love and Libido, and I interviewed Samantha Harris a few months back. She was an E! News host for a long time. I think E! News, and she definitely hosted Dancing with the Stars. And she had breast cancer and wrote a book about her experience. And I interviewed her to talk a little bit about the impact on her and her sexuality. So I'm going to play a couple of snippets from my interview, but I want to start with this one. At this point, you had been with your husband for 10 years. You're now, I think you said you just celebrated 20 years. You're about to celebrate 20 years.
We just celebrated 20 years. We've been together 23 years. Thank you.
Yes, you've been together. You've got these 2 little girls, and then you're hit with breast cancer. What was that like within your relationship?
It was very, very challenging in some ways and also incredibly bonding and expanding in other ways. You don't realize when you say "till death do us part," and in sickness and in health, you say all these words as you're getting married. And you realize, as of course you're going through a hardship, or in this case, a diagnosis, just how much you need to lean on each other. And the fact that he missed because I told him not to come to that initial appointment when I was diagnosed, and then he did not miss another appointment after that. Even if I said don't come, he's okay. I was in the hospital after my mastectomy for 5 nights, and he slept sitting up, and he's 6'5", sitting up in a chair, not comfortable. My sister came in town. She'd take a couple nights so he could be with the kids as well, and they kind of share those duties. And you realize just how much you need to be able to lean on each other. I mean, it's true love when after all that anesthesia and you can't poop, he gave me that. Yeah. Giving someone you love an enema is true love.
Yeah.
Okay, that's TMI for anyone listening. But
And that should be worked into the vows, like through constipation or not.
Right, exactly.
Yeah.
And I remember even thinking, and I know, you cover so much about sexuality and sexual relationships. I remember thinking, well, if he has to do this for me, because I can't physically, because of all my stitches and everything, I can't give myself this enema that I need. And he does this for me, and he sees me in this way, lying on my side, butt up, whatever. Is that going to ruin our sexual relationship? Is he now going to just only see that? And so I had those fears and I had those thoughts. And it's so interesting to think that, again, being in a secure and safe long-term relationship, how you can do something like that and go on to continue to have some of the best sex you've ever had in your life. And the best intimacy in your life. And that, to me, solidifies why now we're going on 23 years together.
Okay. I just think that's such a kind of beautiful way to start this conversation, because hopefully gives people a lot of hope. Oops. Let's see. How do I go to the next slide? Okay. At this point Okay. So let's talk about some of the individual components. So we've got, in most cases, a lot of disruption to body image. A lot of people go through surgery or experience hair loss. Scarring can significantly influence how individuals see and feel about their bodies, oftentimes diminishing feelings of attractiveness or sexual confidence. Oftentimes people experience hormonal changes. So chemotherapy, radiation, and hormone therapies can introduce early menopause for a lot of women, or lower estrogen or testosterone levels in men, or cause vaginal dryness, decreased libido, or pain during sex. And then speaking of fatigue and pain, persistent fatigue and physical discomfort post-treatment often reduce energy, which definitely impacts interest in sex. And then there's the mental health impacts. So depression, anxiety, trauma, or fear of recurrence can blunt sexual desire, because it narrows people's attention to survival over pleasure. And then trauma responses like dissociation, for instance, can also interfere with people's ability to stay really present and engaged during a sexual experience. The relational components, so there can be emotional disconnect. Partners may struggle how to express desire, support, or touch post-diagnosis, especially when both are still grieving the old normal. And this kind of disconnect can create a lot of emotional or physical distance. Caretaking roles is a big one. That shift into caregiver patient dynamics can be a huge erotic block. Because when one person becomes a caregiver, it can be difficult for either of them to see each other as a sexual being. And there can be communication difficulties. So, a lot of couples avoid discussing sexual concerns out of things like fear, shame, or desire to protect one another from added stress, which can reinforce avoidance and reduce intimacy. And then your partner's fears and reactions. So a lot of times there's secondary trauma that's happening along with the person who's going through cancer. So they may be afraid of hurting the survivor, or they may be impacted by their own grief or sexual insecurities, which can influence their desire and engagement. And then finally, there's environmental components. So medicalization of the body, frequent clinical visits, invasive procedures, a focus on pathology can kind of alienate individuals from sensuality and pleasure. I have a lot of people who will say things like, my body just kind of feels like a test tube. When you're poked and prodded with that degree of frequency, it can really kind of feel dehumanizing in a lot of ways. And then the cultural silence and stigma. Breast cancer or any kind of cancer can kind of be framed as a survival story, but sexuality is rarely discussed in treatment planning, or in survivorship care, which means a lot of survivors can feel kind of isolated in their sexual challenges. And then there's oftentimes lack of clinician guidance. A lot, aside from Anovo, because you guys are doing such a great job, a lot of healthcare providers feel ill-equipped to discuss sexual health, or even have the resources available to them to support their patients post-cancer as they navigate sexual challenges. And then there's a huge lack of social support in a lot of cases. So, in many places, there's not really a ton available in terms of peer communities, therapy, which can, if it was present, can do a lot to kind of buffer some of those negative effects. Okay, let's see here. I had closed, I think when I'm screen sharing, let me see if I can see the chat. Okay, I just wanted to check the chat periodically to make sure I'm not missing anything. Okay, I'm going to continue. So what can we do about all of that? Because it is a lot. A lot of people have questions like if they'll be stuck in dysfunction, if they will ever have good quality sex again. And I think it's helpful to kind of talk about the spectrum of sexual satisfaction. So what do I mean by that? Well, okay. I haven't done a PowerPoint on this topic specifically, and I did my best to order the slides, but I may be jumping around a little bit. I want to talk for a second about this concept of eros versus thanatos. So Freud kind of pulled from Greek mythology to describe thanatos as the death instinct, the things that make our lives kind of like a destructive energy, the things that pull us down, in contrast to eros, which is, the root of the word erotic, but he described it more as our life force, the things that pull us up and out and help us to connect. And I think it's helpful to kind of come back to these concepts when we're talking about navigating sexuality with cancer, because cancer, immediately, I think for many people, connects us to that thanatos energy. We are a lot of times we're looking at death right in the face, or we fear like we are, death is right around the corner potentially, which can obviously pull us down big time. And so to then try to connect with Eros, which is on the opposite end of the spectrum, because it's our life force, it's what, makes us feel vibrant and connected and creative, can feel like it's two totally polar opposites and really unattainable for a lot of people. But I think that with a cognitive reframe, which I'm going to talk a little bit throughout this presentation, we can actually rely on Eros and sex because it is so life affirming to help draw us away from that energy that Thanatos is kind of trying to get us to stay into. Okay, this is the spectrum I was referring to. So when we think of sexual satisfaction, it can be helpful to think of it occurring on this spectrum. With sexual dysfunction, when I'm working with patients, a lot of times when they come in, I'll ask them to scale how satisfied they are with their sex life on a scale of -10 to +10, where -10 is like, holy hell, I never want to do that again. And +10 is like swinging from the chandeliers. And so a lot of times people will come in feeling very dissatisfied with the sex that they're having. So they're somewhere in that negative range. Oftentimes, not all the time, they're experiencing some kind of sexual dysfunction. And then as we move through the spectrum, we move into more sexual satisfaction. And then at the upper echelon of the spectrum, we have optimal sex. And it's this area of sexuality that is only more recently being examined. So we have a ton of research looking at sexual dysfunction. We've got, pretty solid research looking at sexual satisfaction, but what constitutes that really optimal sex is a bit newer when we kind of look at the broad, history of sex research. And just to reflect back on that snippet I shared with you in my interview with Samantha Harris, if you noticed, one of the things she says is we went on to have some of the best sex that we had ever had. And so the research on optimal sex, which I've done some of my own research in this area, actually finds that for a lot of people, when they come out on the other side, they find that the sex can actually get better. I just want to check in one more time on the chat. Hold on, where did it go? Can you all hear that
I
dog
can let
barking
you
in the
know.
back? Can you hear the dog barking a lot?
No, I don't hear it, but I can
You
let you know
can't?
if something pops up. Oh, there's something in the chat. Oh,
Okay, they said no. Okay, for me, it's very loud. It's good walking here. Okay, I'm gonna close this. Okay, so let's take a look at what the research says. Okay, so in my research, I was specifically interested in whether or not people could experience a state of flow during sex. Let me see if I have that research question. Yeah. So for people watching who don't know what a flow state is, it's the state that we get into when we are engaged in an activity in which we experience things like loss of space and time, complete absorption, a sense of unity or merger. Think of a surfer who's at one with the wave. And I wanted to know if that's the state that people were getting into when they experienced some of the best sex in their relationship. And I did that because, after doing this work with clients for so long, I could get them to kind of move up that scale to where they were feeling more satisfied sexually, but oftentimes they were longing for even more intensity. And they would often cite like the honeymoon phase as being the best sex in their relationship. But I knew the honeymoon stage wasn't sustainable. As I started paying closer attention to the language they were using to describe the sex they wanted, words like effortless, I want the world around me to disappear, I want to feel lost in the moment, it occurred to me that they were talking about flow state. And when I went to look at the research, I found that there was nothing out there aside from Peggy Kleinplatz's work, which was very close to my research question. And so I initiated a study. And the reason I'm talking about this is because I had 100 people in my study, and I had really long conversations with them about specifically the ones who got really high scores about what they did to get into a flow and when in their relationship that happened. And there were so many people who talked about getting into it after having gone through something really devastating or life-changing or difficult, whether it was individually or in their relationship. And I talked to a lot of people who, lived with chronic pain. I talked to people who had been through cancer. And so we know, and I include this just because I want everyone listening to have some hope, again, that the sex that you rediscover after something as devastating as cancer can be even better than what you had in the honeymoon stage of your relationship. Let's see. When I had conversations with these people, these 5 core themes emerged. So these people were very sensual, they were curious, they could adapt to the world around them and to changes that they were experiencing. They were really great with vulnerability, and they were attuned to one another. And I want to focus on a couple of these in the rest of my talk today, because I think that there's a really specific tie to navigating and awakening desire through cancer.
Emily?
Okay.
Just a quick
Uh-huh.
question in the chat that
Oh.
maybe describe a little bit more. Hyper focus equals flow. Is
Oops.
hyper focus maybe a little bit more?
Hyper. Hold on, I'm
same?
trying to go back to the chat. How do I get that screen? Okay. Oh, someone said there's tech issues on the doctor's end. Are y'all seeing any tech issues?
I see your presentation fine
You
here.
do? And you can hear me okay?
Yes.
Okay. Okay. So maybe it's just that person's computer. Who knows? Hyper focus. Yes. When we're in a hyper focus, it's not just hyper focus, but yes, focus and kind of that rapt attention is a component of flow for sure. Okay. So let's talk about sensuality. I think I skipped ahead. I go back. Oh, shoot. Okay. Sensuality describes the degree to which you fully inhabit your body during sex. Learning to tune in to each of the 5 senses enhances the quality of the sexual interaction. Sensual embodiment can be thought of awareness as the body, as opposed to awareness of the body, which I think takes us a step beyond mindfulness. I know you guys had Lori Brotto on, and I pull from her research a lot, and she did such wonderful research on mindfulness, specifically among cancer patients. And I think that that is such a great first step, because when you are flooded with intrusive thoughts or feelings, we need mindfulness techniques to kind of begin the process of detaching them and bringing our awareness back to the body. But it's kind of a mental gymnastics, and it's not enough to get you into that hyper-focused flow state. And this quote comes from Mark Walsh, who's an embodiment expert. He says, again, embodiment can be thought of awareness as the body as opposed to of the body. So when we are fully embodied, we're not really running through that mental gymnastics as much. The mind, as we typically think of it, kind of quiets down. And what I really encourage people to do to help them stay in touch with their sensuality, I mean, one of the many things, is to focus as much as possible on what is happening as opposed to what isn't happening. And this ties in a lot to some slides I'm going to share on adaptability, because it's really easy when we're going through a challenge to focus on all of the hardships that we're experiencing because of that challenges. Our mind tends to go towards the negative more so than it does to go towards the positive. So we have to kind of actively fight that, and focusing on what is happening in the moment can help a lot. The 2 components of flow. So flow has 8 components, and the 2 that I think relate the most to sensuality are complete concentration. So it's really important as you're beginning the process of reconnecting sexually to create an environment that's conducive to focus and relaxation. So you and your partner need to be very clear on what that is for you. As much as possible, you kind of want to reduce the mental load. In my book, I write a lot about the difference between single tasking and multitasking. Our smartphones have given us the ability to do 2-3 things at once all day long, and it's not realistic to expect to make that shift from split attention to the singular focus that you want to have, which is necessary to get into that flow state during sex. And so I think for anyone who's trying to reconnect sexually, especially if it's happening on the heels of something like cancer, when you're beginning that process of reconnection, or really at any stage that you're wanting to give sex the attention it deserves and optimize it as much as possible, you want to keep this in mind and try to single task as much as possible, just even throughout the day, because that'll slow the mind down and make it easier to transition into the body. This next one, clear goals and immediate feedback. So we know from flow state science that people are more likely, especially in group dynamics, to get into a flow state when there is a clear goal about what you're hoping to experience and immediate feedback as to whether or not you're reaching that goal. So think of a sports team who's playing together on the field. They have the clear goal of winning the game. Or if we break it down further, they have the clear goal of the play that they want to do on the field. And they're getting immediate feedback in the moment as to whether or not what they're doing is working toward or against that goal. 99% of sex therapists will tell you not to have goal-oriented sex, which is well-meaning, but I think we can at times use goal setting to help drive focus. And remember that flow follows focus. And so, if you are, let's say, working on discovering new erogenous zones because your go-tos have been affected from your cancer treatment, that's a goal that you can discuss upfront with your partner. And I think when two people, like I said, are very clear about what goals they're working towards, it's a lot easier to potentially get into a flow state, and have that kind of better than good sex. Okay, so just a few more points on sensuality. The focus is on how the body lives, not how the looks. I mean, body image can do a lot to kind of threatens our relationship with our sensuality. So you want to focus again on like how it lives, what is happening. Find an area of pleasurable sensation and focus on that, even if it's not sexual. So the pleasure pathways, we can't remember that first slide that sex doesn't live in a box. The more we can do to awaken pleasure in the body, even if it's not sexual, the easier it will be to make that transition. Self massage is a great way to start because it reestablishes trust between you and your body. And eventually, you want to try to shift the focus from that outside in gaze. So, a lot of times we don't realize the degree to which we're spectatoring or kind of spectating when we're trying to have sex. And that's where that kind of inner critic or judgment, that judgy feel can come, like we're not as good as we used to be or whatever. And so shifting that gaze from the inside out can go a long way in helping us to stay connected to the sensations. Let's see, whoops. Okay, I saw the chat. It's too hard for me to go back and forth the chat. So I'm sorry, I'm just gonna have to wait till the end. I see it ping and then it disappears. So we're just gonna wait till the
I
end.
can read it too.
Oh, okay, yeah, that would be helpful.
Someone says, I'm still in the quote, I am bitter and I need to find a different way after 20 years of marriage. How do we get to letting go of that and focus on a new goal?
So I'm going to talk a little bit about this in this section, adaptability, and I can talk, depending on how much time we have, kind of about the process of acceptance, because grief is a big part of that. And I don't know that I included it in this presentation, but for instance, in the adaptability section in my book, I write a lot about the difference between people who experience post-traumatic growth versus people who stay in post-traumatic stress, and kind of holding on to bitterness about the trauma that you experience is understandable. A lot of people would, but learning to let go of that and growing from it. I think I talk about it a little bit in here, is kind of a shift and something we now have skills and tools to offer. So hopefully I can answer it a little bit. And if not, I can give you some resources. Was that the only one, or was there another question?
There was just one more comment discussing satisfaction during a state of consciousness called flow. In this state, you're completely absorbed in an activity, especially in an activity that involves their creative abilities.
Yeah, so historically, most of the flow researchers, most of the flow research was in, creativity. So like the arts, also in kind of athletic things. Like I said, people who get in the zone when they're playing sports. We see it also like, in surgeons who can operate for hours without stopping for a snack or a pee break or whatever. But like I said, there just wasn't really anything out there. Mihai Csikszentmihalyi, who's the father of flow, has like a short paragraph mentioning sex in his book, but there really wasn't any studies, which was surprising to me because I'm like, of course, that's what people want to experience during sex. And hopefully we don't have to be like a professional musician or painter or surfer to experience it. If sex is one thing that most adults are doing, and if what they want to feel based on what my clients were telling me is a state of flow, I wanted to offer them some tools to hack it. And I have, and the feedback has been really great. So now you'll have them as well. Okay. Adaptability really is about navigating the invariable hurdles that come with life. And I would say, of any of the themes that came up in my research, the one that relates the most to desire through and after cancer is adaptability. The people I spoke to had, really creative ways of reconnecting with one another through challenges that they had experienced as a couple. This is in part about expanding the script. So we don't realize how narrow of a script we can have when it comes to sex. It's like, first I do this, and then we do that, and then hopefully we have an orgasm and the whole thing is over. One person I spoke to, for instance, said they never thought of sex as having a beginning, middle, and an end. They thought of it more as this constant energetic charge, something they could kind of turn the heat up and down on depending on what was going on. And I think when we shift the way we think about that erotic energy that's there between two people, we expand sex beyond just a kind of juxtaposition of body parts. It's less behavioral and more energetic. All right. So again, Samantha, when I'm doing this interview, I was like, gosh, you're hitting everything I write about in the book. So I had to include some of the slides because I just think it's really nice to hear it from someone else. I'm going to play the snippet now on how she did that.
And, I think to dive a little deeper into the psychological that goes on with losing your breasts.
Yeah.
So here I was someone, like, I was someone who waited after sex until I was in my mid-20s. I was very, very picky and careful with how I allowed my sexuality with a partner to be. I really wanted to be in a safe space with someone who was safe and was going to be there. And I'd wake up the next day and they were still there. And so I had a very long time of needing to figure out what else on my body could be, aroused. And for me, that was my breasts. And I loved the interplay and the arousal that I could have just from breast play. And that was really awesome. It really got me right through my early 20s. And I loved that. And here I was looking straight ahead and having those cut off of my body. And yes, I was 40, and yes, obviously I had sex. I had 2 kids already. But I loved what they offered me. It was just awesome. Like, I will say, I do miss them.
Yeah, I get that.
So there was almost this sadness in knowing, going into a double mastectomy, that I would have no feeling in my chest wall again. And even if I was lucky enough to keep my nipples as I was, there would very likely, 99% chance be no feeling. And so as the nerve started to regenerate a little bit, the feeling that I get is not comfortable. It's actually an uncomfortable feeling almost.
Yeah.
And here's where flipping the script really helped. Instead of focusing on, I can't believe I'm not going to have my breasts as part of my sexual being physically and for arousal purposes any longer. I went, no, but this is, it's not okay. I don't want it, but it's going to be okay because, first of all, thank goodness, the rest of me's working great. And that focus of just even the feeling of a hand brushing up a leg or on an arm or across my back or on my stomach, or even I can feel right between my breasts, like literally center line. So, and my neck, and all of a sudden I really focused in on all the other amazing parts of my body that could tap into arousal, that could tap into that sexual connection, that physical connection, and that body to body, the skin to skin. It really helped me get through. And am I over the fact that I don't have them? No, I mean, I still miss them, but I am through that. And I have discovered an amazing sexual awakening in my now, I'm 50 now, that I didn't realize could be there, especially without breasts. And that's exciting.
Okay. I just love the way she illustrates that. I mean, in this clip, she is talking about expanding her script. She is talking about post-traumatic growth, which I just mentioned. What we know from the research on the difference between people who stay in post-traumatic stress, which is that kind of constant trauma response, versus people who move into growth. It's not that they necessarily get over the trauma in the sense that they forget about it and it no longer affects them, but they integrate it in a way that helps them, for instance, kind of find meaning through it. Like she says, I still miss them, but I discovered all of this other wonderful stuff about my body. I saw the chat pop up. Do you mind reading me the question?
Sure. Someone just made a comment,
Mhm.
tears in this segment, this really hits home.
Yeah. Yeah, I know. My eyes welled up with tears probably 15 times in this interview, and like full body chills multiple times. I mean, she is just such a gem of a person and very accessible. So I encourage you guys to reach out to her. Okay.
And, I think
Oops. Okay. So when you expand your script, you discover things about yourself that you never would have had you not gone through this, which I think is where the beauty or silver lining lies. We have, as she says, an entire body that is full of erogenous zones, and the brain is malleable. So, like she said, she had this brain boob connection for a really long time, but she learned to make new connections from her brain to other parts of her body. And we have to remember that we can do that too. Flipping the script allows you to think outside the box so that the brain can regenerate new pleasure pathways. I love Susan David's work on emotional agility. So she talks about like stepping out, which is essentially mindfulness. So, kind of noticing that thought, but then stepping out from it so it doesn't emotionally consume you. One of the questions she always encourages people to ask themselves is, but what else am I? Yes, I, have gone through cancer, but what else am I? As Samantha Harris said, yes, I had lost my breast, but I had this entire body that was working great, and let me kind of focus on that. So it's really easy to reduce ourselves to whatever struggle that we're experiencing. But when we learn to look beyond that, we can begin to wake up again. Not wanting to feel, Susan David refers to as dead people goals, because suffering is built into the human condition. So people who say, well, I don't want to feel anxiety, I don't want to experience trauma, I don't want to have to have these conversations with my partner, that bitterness, that resentment that we can get really stuck on, are dead people goals, because this is life. We are going invariably, if it wasn't this, it could have been something else that will force you to have those, conversations and kind of draw into your ability to kind of navigate the challenge. And then the last component of emotional agility is that she encourages people to let your values, not your fear or habit, guide you, which I think is such a great reminder. So an example may be, I'm afraid to talk to my partner about intimacy, but honesty and connection are core to who I am. So I will take the first step. So a lot of this is reframe. Okay, one more clip. Tell me more, if you don't mind sharing, what you noticed about how sex improved as you recovered and you guys started making your way out of this scary time in your life.
I think, look, it's obviously for women, our breasts are a big sex organ. There are defined in many ways our sexuality. So as a breast cancer patient, especially exploring some sort of severe surgery like a mastectomy, where you are literally having your breasts removed, there is there's so much emotion that goes with that. There's so much fear in, will I still feel like a woman? Will I still feel sexy? Will I still feel wanted? And we have and this is something that every woman who's gone through a breast cancer surgery, who I've had the pleasure of being able to explore and confide in and share with, we all seem to have. It's about, oh, the one had no more nipples left. I was able to have nipples sparing, and thankfully they survived. There's no feeling in my breast, but at least visually, I can look in the mirror and I can see, that I still feel like I have that. I had, implants put back in, and to maintain my, that feeling, right? We have to figure out what's right for us. I know women who said, you know what, I don't even want the implants. I'm going completely flat, and embracing that, and it's so gorgeous and beautiful. I know women who've had the nipple tattoos put back on, so they feel like they have some visual symmetry, more for themselves in the mirror, right? So you have to explore what's right for us, because if we don't feel as whole as we possibly can after something that has been not just a devastating diagnosis, but a devastating physicality and physical change. Right. But even though it's devastating, we don't have to be devastated.
So I had to land on that last quote. It's devastating, but we don't have to be devastated. So staying devastated is staying stuck in the trauma, which is going to make it really hard to move beyond that. And again, if we have time, I can talk a bit more about the process of acceptance and moving on. But okay. And then I love Kristin Neff's work on self-compassion. So like a component of her work is self-kindness versus self-judgment. So what's wrong with me? I should want this by now, referring to desire, versus it makes sense that I'm not in the same place I used to be. My body and heart have been through a lot. I deserve patience and care. So judgy statement versus kind statement. Common humanity versus isolation. So that feeling that no one else is dealing with this. And it may be true in your immediate circle, you might be the only one dealing with this, but you have to remember everyone has their struggle. And so stepping away from that, this is part of the human condition. Others have walked this path too. I'm not the only one figuring this out. And then mindfulness versus over-identification. So this means I'll never feel sexy again. Remember I talked about that kind of over-identifying with your struggle, like kind of reducing yourself down to your struggle, versus mindfulness. I notice I'm having a painful thought about my desirability. This thought is valid, but it's not the whole truth. I hope you all have watched Dying for Sex. It was probably the most beautiful series I have seen in the past, I don't know how long, I maybe ever. I thought it was absolutely gorgeous. And obviously it's a story about her sexual kind of healing and discovery as her cancer comes back as stage 4. But to me, the story of friendship that we see played out in this series was just so beautiful, to have that community and peer support. And you see her going to her cancer groups and working, the connection she had with her social worker, and not being afraid to reach out to people so that she could rely on them. There are still places in the world where HIPAA doesn't exist. And well, at the end of the day, I think we need HIPAA. There are places where like you're going through something and they will call your whole family to let them know so that they can come and be there for you. But that's not our culture or society or the law, for good reasons. But I think having that community and peer support is crucial. We know from research on happiness and longevity, for instance, that community is like the number one thing that keeps us going. And so I encourage everyone listening to kind of reach out to people in their community as a source of support, not just because it feels good, but also because it takes some of the burden off your partner. And I'm going to talk a little bit about the caretaking role and its impact on sex down the line. I'm just looking at the time. I might fly through a couple of slides. So vulnerability was another theme that came up in my research, which I think also applies within your relationship when it comes to having the conversation about navigating sex. It's interesting. I used to tell people when it came to talking about sex, because of any reason, I would say, open it with the fear. I feel really scared or anxious to bring this up with you. Are you in a place where you're open to hearing what I have to say? Now I tell people to kind of lead with the same intro. I feel scared to talk about this, but I trust that you are not going to judge me and will be open to what I have to say, because then they want to live up to that expectation and it's pretty foolproof. So that's the conversation starter that I encourage everyone to use. You set the pace and your partner needs to be very clear on that. That was something I didn't include it in today's conversation, but again, something that Samantha Harris talked a lot about, that her partner really took a back seat and let her kind of drive the boat. And they had a lot of conversations about boundaries, which, as she began to feel more comfortable, began to move, but she was always the one to set them. And because she had enough safety and security in her relationship and enough trust with her partner, she knew that she could do that. So that's super important. I'm not going to talk too much about the paradox of control. So let's talk about the caretaking role a little bit. We make the vow in sickness and in health, but the fact is caretaking can be kind of anaerotic, and it's something we do need to be mindful of when it comes to sexual desire. But there's a lot we can do about it. I mean, at the end of the day, your partner most likely is going to be the one taking care of you. And so, and we want that, they're ideally who we feel the most safe with, who we trust to, keep our best interest at heart, and who we want by our side. But there is a line. So naming the role, just saying it out loud, like, I know we have kind of slipped into this patient caretaker role, can foster clarity and attention. And then when you want to break free from it, you can say things like, hey, tonight, can we just be us? No treatment talk, just connection. Because when that role is happening, but you haven't really identified it, it can feel kind of like the elephant in the room. You want to try as much as possible to create off-duty time, and then set boundaries to avoid burnout. So really, think clearly about what you can do for yourself, what can be delegated to other friends and caretakers, and then think about what you need your partner to do for you. Okay, curiosity. So people who maintain a sense of curiosity relate to their partner with a sense of wonderment and awe. I'm going to kind of skip the second bullet point, but as it relates to cancer, a lot of it is going to come down to unlearning what you thought you knew. We don't realize how many assumptions we have about our sexuality or about our femininity that have been inculcated in us due to the society and culture in which we live. And, remember I opened the slides with all the different factors that can influence our sexuality. Sometimes it's when we're hit with something like cancer that we are forced to unlearn these associations that we didn't even realize were so attached to our sexuality. Again, I think this Dying for Sex series does such a beautiful job as she's working through her trauma and kind of peeling back the layers, and leaning into parts of herself that were asleep. Okay, I'm going to skip that. Oh, okay, that was the end. Okay, I thought I had more slides. Okay, if you want to read more about these components, you can check out my book. There's tons of free bonuses on my website that you get access to with purchase. So, and you can take a look at that, and then follow me on all the social media channels at Dr. Emily Jamia. And that should wrap up my presentation. Okay, so I'm going to open this back up. Let's see. How do I stop my screen share? I never know. How do I stop the screen share? Oh, here we go. Stop
Sorry,
share.
at the bottom of your
I
Zoom.
see it.
Yeah,
Yeah.
there you
Okay.
go.
Awesome.
Perfect.
Okay. So any questions based on the information I shared with you all today?
Thank you so much. This was great.
Yeah, my pleasure.
So many new points, even for me, just ending this series. I think there were just new thinking points for me as a clinician as well.
Yeah,
Uh,
that's great.
some really great comments. I don't know if you can see them. So wonderful. Just some.
Yeah, no, I can
wonderful,
thank you all. Thank you so much.
uh, what are your thoughts about partners and in-laws dealing with caregiving and them not getting along?
Oh gosh, that would probably be another presentation in and of itself. Again, this forces people to set boundaries, and it kind of is going to be on you to say what goes. And, I hate to say that, but at the end of the day, it's your experience, it's your body, it's your choice. And so you have to be very clear, with everyone in your family and let them know, hey, I need to feel like I have a voice here. I have never felt more out of control in my life. And it makes me feel grounded and in control when I feel like the people who I love are respecting the boundaries that I need to set. So just give me that is probably what I would say very firmly.
Like you said, that could be, that's a whole complex. That could be a whole
Oh
separate.
yeah, for sure. For sure.
Someone mentioned, and I was going to say the same thing. I like unlearning what you thought you knew about sex.
Yeah. Yeah. I
Like
mean, I have
that's
so many sentence prompts that I love to see how people fill in, like, sex is for, or most women feel, or most men want, the way we complete openers like that, I think is very telling on the beliefs that we don't even realize we hold about sex.
And that's really great. I've been thinking about that since you said that, but I also think even on our viewers, when they go back and look at their slides, that the prompts that you
Mhm.
did have in there, because I think that
Mhm.
getting started with that conversation is something I
Yes.
hear a lot. That's so hard. Um,
Yeah.
having the prompt where you don't even have to think about it sometimes
Right,
takes the
right.
pressure off.
Just follow the script. Don't follow your sexual script, but follow my communication script. Let's see.
That's great.
Mhm.
It's encouraging to hear that there's more than how we were before treatment, finding words to
Mhm.
describe wants, etc. Where is the new language?
Yeah. Yeah, there can be so much more. Oh, it looks like maybe she. Oh, you are so welcome. I'm glad you guys.
Gentle and insightful approach on such a delicate but necessary topic.
Yeah.
Yeah,
And
I
like I said,
really,
I've worked, it means a lot to hear the positive feedback. I've worked with tons of people post cancer, but I realized as I was putting this together that I've never actually done a presentation on this topic specifically. So, it was kind of a first time for me. So I'm glad that you guys enjoyed it and it was cohesive, hopefully.
oh, great, great. Um, I put our evaluation in the top. Oh, here. Okay.
Mhm.
I'm glad it's opening up here. What are your thoughts
Okay.
on reinvigorating that feeling of desire if it feels completely absent? Someone asked me this today too, actually.
Yeah. So starting anyway and starting slow. I don't know if anyone in your previous speakers talked about the difference between spontaneous versus responsive desire. Yeah. So just kind of briefly, that spontaneous desire is that, like, I feel horny, I want to have sex, versus responsive desire means the desire doesn't really come about until there's some kind of emotional connection, or you felt attended to, cared for emotionally by your partner, and a little bit of arousal. In other words, desire doesn't happen until after arousal. So you might, if you don't experience spontaneous desire and you don't at least open yourself up to the idea that you can draw it out, you will probably never have it. So rather than asking yourself the question, am I in the mood? A better question would be like, am I open to? and usually once the skin touches your partner's skin and you're engaged and present, with time and patience, it can start to wake back up again. I don't think desire is something that we lose. It's not like, oh, where did I leave my keys? I lost them. Desire isn't like that. It can kind of go to sleep for a while. But it's something that as long as it's nurtured, it's kind of like a plant. We've got to tend to it and water it and take care of it. And going through cancer, like I said in one of the slides, it really shifts our focus to survival mode. It can kind of make us think, God, like sex is like the last thing on my mind right now. But enough time goes by, your brain starts to think, oh, I guess I don't need that anymore. So you have to be very intentional about waking it up again.
I like that. I like that.
Mhm.
We've sort of talked about these things, but I like the way that you just presented that as well. It's a sleep,
Mhm.
but it's there. And
Yeah.
and that's the survival mode they're in.
Yep. Yep.
And maybe just, bridging a little bit more on that, someone just clarified,
Mhm.
how do we find the language to talk about sex with our partner?
Mm.
Are there a couple more prompts or maybe some, suggestions that you could share?
Yeah, I do. And I also have a list of conversation starters that I'm happy to send over and you can share with the group. If that might be helpful just to kind of have on hand. But, when you say a new language, it's hard for me to answer that without knowing what the old language was, because people have all kinds of ways of talking about sex. I think, like I said, kind of leading with the fear and insecurity. Like people always ask me, how do I talk about sex without it feeling awkward? And I'm like, you don't. Like you do it even though it feels awkward. Anything you've never done before is going to feel awkward. Coming back to flow state science, flow doesn't happen with the flip of a switch. It's actually the third in a series of 3 stages, the first being the struggle phase. When we're in the struggle phase of flow, I mean, think of the musician who's tuning their instruments, or the artist who's mixing their oils, or the surfer just kind of hanging out, waiting around to see if a wave is going to come. They're not in a flow state yet, but they're trusting the process. And in that struggle phase, the brain can be flooded, the body can be flooded with like stress hormones. And when it comes to sex, that often stops people. And they'll be like, no, too hard. I don't want to do that. But if you have faith in the process, you eventually move from struggle to release, which is when the stress chemicals start to work their way out and you begin to kind of feel a greater sense of calm. And it's only then in the third stage that we experience flow. And then integration. So we have to, this again, I come back to Kristen Neff's work on self-compassion, really be kind and gentle. You may hang out in the struggle phase for a while, but just keep at it. Having these conversations is hard, but it's intimacy building. So do it even though it sucks. I mean, I'm a sex therapist and sometimes it's hard for me to have these conversations. Or, when my kids are asking me, where do babies come from? That I have that immediate feeling of like, okay, do the things that you need to do, say the right thing. So I get flooded with the stress chemicals just like anybody else. I think it is vulnerable. It can feel really scary, but you do it anyway.
And we're all be comfortable in the struggle. Yep, we are.
Yeah.
Not
Yeah.
just in this situation, but in
Yeah.
any
Yeah.
situation that come up.
Yeah.
Someone responded, the conversation starters are nice. It's hard when you have no desire at all, but your partner has a high sex drive.
Mm,
They want to go back to normal, but you can't. It can cause resentment and tension, even questions about marriage going forward because needs aren't getting met.
yeah. It's tricky. You want to, a lot of times, because I know this is a mostly women group, both men and women are socialized to think that, men are just interested in sex for physical pleasure and all women care about is emotional intimacy, and that they don't value sex as much. As much as possible, when I'm working with a couple who has mismatched desire, try to kind of marry the concepts of emotion and sex, or kind of emotional connection and sexuality. When I talk to my higher desire partners about what it is why they have higher desire, why they want to have sex, not one has ever said because I want to get off more. If it was just about that, they could take matters literally into their own hands. They want to connect. They want to, it's a lot of times for them when they feel the most connected, the most seen, the most loved. And likewise, women are kind of not really socialized to lean into sex the way that men are. From a very young age, boys are given a lot more permission and freedom around sexuality, where women are given more inhibition and kind of safeguarding their sexuality. And so it can be a difficult wall to knock down, but I think when men start learning new tools to communicate why they want to have more sexual intimacy, and women can start knocking down some of the walls or barriers they may have or inhibitions they may have about leaning into it, and possibly even see sex as a way to escape some of the stuff that's going on in their lives, then that in and of itself can start to bridge the gap a bit. And at the end of the day, most couples are going to have a higher desire and a lower desire partner. Rarely do we partner up with someone where we match 100%. So you want to just kind of mitigate the gap and manage as much as possible. There's so much that goes into mismatched libidos. I can't. There's so much nuance to it that it's just hard for me to answer in a simple response.
Well, you got a comment that was a wonderful answer
Okay,
out
good.
there. Well, this is great. And any last questions here? I know we're down to the last couple minutes. This was great. And that was a lot of food for thought at the end too. I really appreciate
Yeah. Well, thank you all for your questions and candor and positive response. I appreciate it.
Yeah, this is great. And thank you. Thank you. Lots of things coming through. We'll have this recording, we'll upload it, we'll share it with you, we'll share it with our viewers with your slides. If
Awesome.
you have the prompts that you send out, I'm happy to share
Oh
those.
yeah. Will you email me a reminder and I'll send that to you?
Absolutely. And
Okay.
you see Dr. Jamia's book behind you, Anatomy of Desire. You can order on Amazon. I don't know if we have it in our specialty shop, but I'm going to check. And
Copy.
check out her socials at Dr. Emily Jamia. Thank you for coming. Thank
My
you for
pleasure. Thank you all.
access here tonight. And thank you to everyone at the completion of our series here, 11 parts. This has been awesome. We really appreciate you coming, whether it's in person, whether it's seeing it later on our recorded link. This has been an incredible series, and we're thrilled to end with desire tonight. Thank you.
Thank you.
Okay. Have a great night, everyone.